Hello everyone, and welcome to this Evaluation and Program Effectiveness Working Group session on cost effectiveness. My name is Laia Greeno, and I manage the Evaluation and Program Effectiveness Working Group here at Interaction. I'd like to first introduce our speakers. We have Annette Brown, Deputy Director for Advancement and Impact Evaluation Services at 3IE, the International Initiative for Impact Evaluation. We also have three colleagues from the International Rescue Committee joining us: Jeannie Anand, Director of Research, Evaluation and Learning; Juliet Sabon, Research and Evaluation Advisor; and Chip Barnett, Senior Technical Advisor for Organization Measurement. And thank you very much to the IRC again for not only agreeing to present for this session, but actually also organizing it. Just want to run quickly through the agenda. First, obviously, is this welcome and introductions. We'll then be hearing from Annette, who will give a 15 to 20-minute introduction to cost effectiveness, and we'll then have a few minutes for clarifying questions before we turn it over to our colleagues at the IRC, who will present on their approach to cost effectiveness. And they'll be presenting on their experience with measuring the cost effectiveness of two interventions for survivors of sexual violence in the DRC, and also with conducting cost efficiency analysis of nutrition and wash projects in Chad and Ethiopia. And then we'll have 20 minutes for questions and answers. We will be sharing Annette's presentation after the session, but because the IRC presentation contains unverified costs, we unfortunately won't be able to share that presentation after this meeting. Just a few things on the technology before we get started with our presentations. This is what you should be seeing on your screens. If you want to minimize or maximize your screen, you can click the orange arrow. You can view the presentation in full screen by clicking on that blue box. And if you have any questions, you can type it in your question box. And feel free to type in your questions throughout the presentations, and I'll be monitoring them and posing them to our presenters. Everyone in the audience is in listen-only mode, so I'll be posing your questions on your behalf. And with that, Annette, I'm going to turn it over to you, so I am making you the presenter now.
Okay, good afternoon, everyone. I hope that the presentation is visible. I assume Laia will tell me if it's not. Thank you for taking some time out of your afternoon to talk a little bit about cost effectiveness analysis. This, I think, has been very neglected in large part by the development community, and I think it will be very important to begin to emphasize it more and more going forward, and particularly as we have more of the impact evaluation evidence that we can use to actually conduct this kind of analysis. So a quick outline of what I want to cover in my time is start talking about what is cost-benefit analysis and why use it, and do a little bit of economics. Sorry, but I'm an economist, so very quickly talk about the foundation for cost-benefit analysis and economics, and then talk about the importance of impact evaluation to conducting cost-benefit analysis, and move all of that is really to get the foundation for the concept so that we can then talk about cost-effectiveness analysis and how that's a little bit different and what that allows us to do. And then what are some of the challenges in calculating the cost. And then I want to quickly go through an example of some cost effectiveness analysis from a 3IE funded study. And finally, I'll have a slide with some online resources for cost benefit and cost effectiveness analysis. So what is it? Well, cost benefit analysis is a decision-making tool. It is a way to think about what is the best way to achieve the desired outcomes. And here, best is not just how do we get the most of something or the most effective impact, but best here includes a consideration of cost. So it's not just about how effective is something, but in a sense, how efficient is it, where we want something that works well but also doesn't cost a lot. There are two types of cost-benefit analysis that are used in the policy analysis realm. The one that we see most often is really ex-ante cost-benefit analysis. And I should say, somebody asked me in a presentation recently, what does ex-ante mean? And I said, well, it means before. And he said, well, why don't you just say before? And I said, well, because I'm an economist. But I'm sure that's not a good answer. Anyway, cost-benefit analysis that is conducted in advance of a program being implemented. And here, the empirical work and the analysis is all forecasting and prediction. It's conducted in advance in order to make decisions about should we do it or how should we do it. Ex-post cost-benefit analysis is where you are actually measuring true outcomes and you have some actual cost data that you're using and you're trying to get a sense of what the cost-benefit analysis is after the fact. So many large public organizations use cost-benefit analysis, and as I mentioned before, most of the examples are really what we would call ex-ante cost-benefit analysis. In other words, asking people to forecast what they think the costs and the benefits will be in order to make a decision about what policy to choose or how to allocate resources. The U.S. government is an excellent example. By law, if somebody wants to put a new regulation on the books for the U.S. government, they need to conduct cost-benefit analysis before the fact in order to show that the costs to the economy and to various agents in the economy of this new regulation do not exceed the benefits that will accrue from this regulation. And if you look through U.S. government documents, you can find lots of reports where this cost-benefit analysis has been done. The World Bank used to do a lot more cost-benefit analysis than it does now because it used to be more the case that any new loan actually needed to be supported by cost-benefit analysis, where the cost of the loan was compared to an estimation of the benefits that would accrue from it. You can still see many examples where cost-benefit analysis is conducted for individual World Bank-funded projects. USAID has recently re-emphasized cost-benefit analysis as one of the tools that it wants to use as part of the USAID Forward campaign. So here on the slide there's a quote that comes off of the website talking about how cost-benefit analysis is an essential tool for USAID Forward and that it will allow the agency to analyze the design of a project, to figure out the best way to work with donors in the private sector, to identify improvements to existing programs. And much of this work, much of what I've seen has been, again, ex-ante cost-benefit analysis, so trying to look at proposed programs before they're implemented and understand what the costs and the benefits will be. But what we hope is that they will also be using ex-post cost-benefit analysis to inform those decisions over time. So what we're talking about today is really more ex-post cost-benefit analysis. That is trying to understand what has gone on with a program during or after its implementation, both in terms of the observed benefits and also the observed costs. The value here obviously is not so much in making the decision about whether to implement that program or allocate resources to that program since it's happened, but it helps analysts and researchers to learn about the class of such programs and to make decisions about that type of intervention in the future. Okay, so I warned you that there's a little bit of economics. Probably everybody has seen this very basic graph from Econ 101, and all I want to emphasize here is that the decision-making foundation for cost-benefit analysis. So in simple economics, where you have a market working, resource allocation decisions are made by the market looking at the equilibrium between supply and demand. So supply represents what producers are willing to provide, and demand represents what consumers, or we might think of as beneficiaries, want and how they value what they want. And the market gives us the information that we need to make the decision about how to allocate resources. And we can think about the supply curve as really representing marginal cost and the demand curve as representing marginal benefit. Okay, don't run away. See, it's gone. It's gone. So the question is, well, what if there's no market? And again, from Econ 101, we know that there is not going to be an effective private market if there are what we call externalities. That is, if there are good things that happen as a result of the production of that good that do not accrue to the person who pays for it, or there are costs that occur as a result of the production of that good that do not accrue to the person who produces it. In the cases where we think that there are goods that have externalities that we want to have, governments or others, like private foundations, choose to provide those goods and services. So pretty much all of the development work we do is because there are governments and other donors who think that there's a social benefit from the production of these projects that is worth the cost that they're paying for it. So already we know that these decisions about allocating development dollars are almost always made outside of the market context. So that wonderful thing called the invisible hand does not help us make the decision about what to produce. But funders and we, even implementers, still want to make optimal resource decisions in the production of those development goods and services. We still want to be doing the best that we can with the resources that we have available to us. So that's where cost-benefit analysis comes in. In this context, what we're looking at is the same idea about trying to find an equilibrium between supply and demand, but here our supply is really the marginal social benefit, and these are backwards. Sorry, I just took this picture from somebody else and these are backwards. And the marginal social cost. So marginal social benefit. How do we then measure marginal social benefit given that we don't have the function of a price to do it for us? The social part is pretty easy because we can just decide what it is, what those outcomes are that we think are important to the society, and we can look for ways to measure those outcomes and to observe those outcomes and to measure them. So that's how we get the social part. How do we get the marginal part? We get the marginal part using impact evaluation. So I'm sure that many people will be surprised that we've actually made it to the 11th slide of a 3IE presentation without, other than in the outline, somebody talking about impact evaluation. But here it is. I'm going to talk for a second about impact evaluation. Impact evaluation measures the net impact attributable to a particular intervention by comparing the intervention outcome to what we call a valid counterfactual. Okay? So there are two things that are important here. One is impact evaluation allows us to measure this outcome that we know is attributable to the intervention. So what is actually produced by the intervention that we're trying to make a decision about or that we're trying to learn about. And it allows us to measure that as a net impact. And that gives us something to compare to cost. If we're just doing something like contribution analysis, then we can't really compare it to cost because all we know is that something happened and we think that the program that we spent money on had some contribution to that, but we don't really know how much. It doesn't help us to understand whether or not the cost of that program was worth it or not. So impact evaluation becomes a very powerful tool because it gives us the marginal part in marginal social benefit. Okay. So what about the benefit part then? We have marginal, we have social, what about benefit? Well, in cost-benefit analysis, the costs and the benefits, both the financial costs and benefits and the social costs and benefits, are all monetized. So first they're quantified, So we figure out a way to represent them in numbers, and then we figure out a way to transform those numbers into dollar values. That's a pretty tall order. And in fact, a lot of the cost-benefit analysis, a lot of the writing and the work that's done is really that exercise of figuring out how can we monetize costs and benefits that are social rather than those that are obviously purely financial. The monetization work often requires some pretty heroic assumptions. So when we're not feeling so heroic, we use what we call cost-effectiveness analysis. Cost-effectiveness analysis allows us to make comparisons in cases when we're either unable to monetize, so maybe we can measure the whole thing that we think is the relevant benefit or outcome, but we don't have any way to assign a dollar value to it. Or maybe we have ways of measuring outcomes, but there's no way to capture all of it in one measure. Okay. What are some examples? Well, some examples might be, again, in development, vaccination. So vaccination is something where we might easily be able to look at a quantified outcome, but we don't really know how to monetize the benefit of having 80% of the population vaccinated, for example. Here's maybe even a better example, which is ex-combatant reintegration. How do we monetize the benefit of reintegrating ex-combatants? This would be an example of improving school test scores or knowledge, or increasing voter turnout. Again, something that we think is very important as a development outcome, but not something that's easily monetized. And finally, voluntary medical male circumcision. Again, something that we can count, but that is hard to put a monetary value to. Okay. So cost-effectiveness analysis compares alternatives on the basis of their cost using some kind of quantified but not monetized effectiveness measure. We still ideally need to quantify, although sometimes we do that just by ranking. And you see it and you can think about it either in terms of cost-effectiveness, so what is the cost of getting 1 unit of what we're measuring as our outcome, or effectiveness per cost. How much of our outcome do we get for $1 or $100 or a given amount of money? And so obviously which way you look at it will affect whether you want to rank order your options from lowest to highest or highest to lowest. So here's an example of an effectiveness per cost ranking. So in this situation, there were a variety of interventions that were all intended as one of their outcomes to increase school attendance. And all of these studies were able to measure a marginal benefit of number of school years gained, and were able to measure the cost so that they could calculate the additional school years gained per $100 spent on the intervention. And by coming up with this indicator, again, we're not monetizing the value of the additional school years gained, but we can still compare them. And we can see here that this intervention on information on returns to education for parents has a much higher cost effectiveness ranking than the others. And the deworming also comes out as being very strong when we look at it in terms of cost effectiveness. Now, if you look at some of these other interventions, you may recognize them as interventions that have a reputation of being very effective. So these are interventions where impact evaluations have shown that in fact they have significant positive impacts. What cost effectiveness allows us to do is say, okay, we know all these things are good, but which ones can we do at the lowest cost? Another example will come from a group of studies that we're funding on voluntary medical male circumcision demand creation in sub-Saharan Africa. So we're currently funding 7 different pilot interventions, all intended to increase demand. And in this case, because the outcome measure is similar across the studies, we'll actually be able to use cost effectiveness ranking to compare which one of these new ideas for creating demand is most cost effective in increasing the number of voluntary medical male circumcisions. Okay, so we talked a little bit about the marginal social benefit side. What about the cost side? Well, the cost side should be easier to both quantify and monetize, but we still rarely see people do this. So there are hundreds and hundreds of impact evaluations where there is absolutely no cost analysis provided. Why is that? Well, one reason is that it's not always as easy to do as we may think it should be, but also another is just that there hasn't been the real push for people to do it yet. And so one of the reasons why doing this webinar is to try to get people to start thinking about it more often. Why is calculating the cost sometimes more difficult than it would seem? Well, first of all, the relevant cost here is not just the project cost. So it's not just saying, okay, well, USAID gave us a contract of $1.6 million, so that's our cost, so that's easy. It's not, because first of all, sometimes what you're doing on a pilot basis, or you're doing it in part of the country, but the idea is that you want the government to scale it up in the rest of the country. And so the relevant costs are not necessarily what your project costs, but what this intervention would cost at scale. You also want to consider what are the other inputs and other contributions that are required in order to make this program happen. So we may have a contract from USAID to implement this program, but it doesn't happen unless the government incurs certain costs, communities incur certain costs, or households incur certain costs. Okay. There may also be social costs or negative externalities. That is, it may be that while we are doing good things, some bad things are happening as well that we don't want to have happen, but we recognize that they're there, and those should also be accounted for. And finally, it's important to think about who in fact pays the cost or incurs the cost. So we can say, okay, there are the project costs, and then there are the government costs, and then there are household costs, but it may make a difference who is paying those costs, what percentage of the total cost of the intervention is incurred by these different parties. Okay. Some other technical issues in cost effectiveness analysis is it's important to understand how many and who need to be treated in order to achieve the measured outcome. So this is, again, thinking about the benefit side. And we want to think about, okay, there's a program and certain people receive the program, and some of those people have a benefit from that program. How do we measure that benefit? Well, it's not just how much, for example, in the education case, attendance increased for students who increased their attendance. We really need to understand the average increase across all of the people that the program hit, because we want to make sure that we're covering all of the beneficiaries that are accounted for in all of the costs. And we do see that this mistake happens sometimes. So people want to measure the benefit just in the cases where we observed the benefit, even though in order to get that, the program had to have a much broader reach. Okay. Another thing to keep in mind on the benefit side is that when you go in and start a program or pilot a program, it may be that you get an immediate strong outcome that won't be there as the program is scaled up, that there's decreasing marginal returns, an economist might say, or vice versa. It may be that actually a program at scale can produce greater benefits than a program that's piloted in a small community. Okay, let me spend just a few quick minutes on one example from a study that's funded by one of 3IE's Open Windows. So this is a program, a study of a conditional cash transfer program in Indonesia, and looking specifically at the targeting. This is a nice example because it's where cost effectiveness analysis has actually been conducted to provide the government of Indonesia the information that they need in order to decide how they're going to implement this intervention, in order to decide how they are going to carry out their conditional cash transfer program going forward. So I already said it's a community-based cash transfer, and the question is, what is the best way to target that cash transfer, or what is the best way to identify which households qualify as poor, or those that we want to reach, and how do we identify them in order to give them the cash transfer benefit? So the study sought to compare, I should say, 3 options for targeting. The first is a proxy means testing method, which is essentially the status quo. And this is where you conduct a survey of households and you ask them questions about the assets that they have, the house that they live in, whether they have a bicycle, whether they have a cook stove, and those things. And you use that information in order to estimate what you think their income or their consumption level is, and then identify them as poor or not poor based on that. What they wanted to compare that to were 2 options. One is a self-targeting option. And the idea here is not just to go and say, hey, are you poor? Okay, we'll give you the cash transfer. But is to introduce some kind of burden or onus that would help individuals select themselves into being in a group that really needs the cash transfer versus a group that doesn't. So in this case, what they said was households, first somebody needs to come in and fill out an application. And so the question is, by requiring that, are you more likely to get the poor households who really need it, who self-identify by coming in to fill out the application? The third option is then community targeting. So what if you get a community group together and the assumption is the people in the community have a pretty good idea of what households in the community are really needy and could benefit from this transfer, and you ask them to provide information in order to identify the households who are going to receive the transfer. Okay. So in the study they measured 2 types of outcomes. One is what they call objective effectiveness, that they look at essentially in 2 ways. First, they look at accuracy. So for all of the households in the study, the control and the various treatment groups, they had information about actual means. And so they were able to look at how the different mechanisms, how the 3 different options, how accurate they were, both in terms of finding poor households and making them eligible, but also in making sure that households that shouldn't be eligible did not receive the transfer. They also looked at then consumption levels across the households. But they also looked at a more subjective measure of the outcome, which is satisfaction. And they actually had about 11, I think they had 11 different questions looking at different aspects of the participants, all the households' satisfaction with these different methods of targeting. They looked at both what people perceived as the effectiveness, so did people think that this method was more accurate, but then also whether people thought this was a good idea and a way to do targeting. So what did they find? You found that from an objective standpoint, self-targeting was actually more accurate than proxy means testing, was more accurate than community targeting. On the subjective side, though, they found almost the opposite. Community targeting was more satisfactory than proxy means testing, was more satisfactory than self-targeting. On the cost side, the researchers looked at both the administrative costs, the program costs, but also, and again this is important for really looking at marginal social cost, they looked at the cost to the households for participating in these different targeting mechanisms. So travel time, for example, for self-targeting, but also for the community meetings, and so on. They also looked at the administrative costs, both at the project level, so how much did it cost them to do it, but then they also made estimates for what each targeting mechanism would cost at scale, with the understanding here that there would be economies of scale, so that the cost would actually come down per household once a certain mechanism was implemented at scale. They also separated household costs into what it cost people who ultimately benefited from the program and what it cost people who ultimately did not benefit from the program. And this is how they present the results, and I'm not going to make you look at this other than for you to see that there's all these pretty numbers that present all of these different concepts. But here's the outcome. So, and here I'm going to present it just in terms of the ranking. So on the left-hand side, you see the outcomes. So again, self-targeting was more accurate than proxy mean testing, and satisfaction community targeting was the highest ranked. On the right-hand side, you look at the cost. So the overall cost, it turns out the community targeting was least cost. But if you just looked at the costs that the households incurred, so suppose you don't care about what the government incurs and you only care about the households, you see that proxy mean testing was the least cost, and in fact the self-targeting was the highest cost. So how might we analyze this information? And part of what this example shows is that even though the whole point is to quantify and monetize and create ratios and so on, that doesn't mean that the policy implications are going to pop out entirely clearly. Some people might look at this, which says, look, self-targeting is more accurate and it's second least cost, so that's looking pretty good. Some people might say, well, yes, but community targeting had the highest satisfaction and the least cost. Some people might notice here that the proxy mean testing was relatively accurate. It was in the middle, but it was the least cost to the household. Or even look here at how well community targeting does. So the question you might ask is, well, what did the government do? And what the government did as a result of this analysis, or at least what they've done so far, is they focused really on these community targeting outcomes and costs, and they decided not to have the program fully community targeted, but to allow community targeting to do the updating. So in between periods when they did a full proxy mean test, they're now allowing community groups to make decisions about whether there are rich households that should be excluded and whether there are poor households that need to be added. So this kind of analysis did have a policy impact. Okay. These, I know this is not very good for presentation, but later when you have the slides, you'll probably want the links. Here's some resources. The first World Bank is actually a chapter, and it focuses on nutrition, but it's nice because it's presented in more of a tool format in terms of how you might fill in a table to understand your costs and your benefits. The second is a JPAL paper on cost effectiveness, so that really explains in much more detail some of the concepts that I've introduced here. The third is a paper in the Journal of Development Effectiveness, which also talks more conceptually about cost effectiveness analysis. And the final one is also a little more like a tool.